Hi, my name is Jay Sugarman, and I want to welcome you to Innovation Showcase. The main purpose of this ongoing series is to inform viewers about exciting innovations and creative individuals across the fields of business, science, technology, education, and the arts. Today, we're exploring the inspiring work of Alter, an organization that's transforming the way dementia education and awareness reach Black communities by bringing together faith, science, healthcare, and community leadership. Through partnerships with churches and local organizations, Alter is helping families recognize the signs of dementia earlier, reducing stigma, connecting caregivers with resources, and fostering conversations rooted in trust, compassion, and hope. Joining us is Dr. Fayron Epps, founder and CEO of Alter. Dr. Epps is an internationally recognized nurse scientist, educator, and leader in dementia care. Her groundbreaking work has demonstrated how faith communities can become powerful partners in improving brain health and supporting individuals and families living with Alzheimer's disease and other forms of dementia. Also with us is Tia Delhomme, site coordinator for Good Shepherd Community Care's Boston initiative, who works directly with local congregations and community partners to bring Alter's innovative model to neighborhoods throughout Greater Boston. Together, they're building stronger networks of education, support, and care while empowering churches to become trusted centers for dementia awareness. During the program, we'll learn how this innovative partnership is changing lives, why cultural responsive approaches to healthcare matter, and how communities can work together to ensure that no family faces dementia alone. Let's start by meeting our guests. Welcome. So delighted you're both able to be here.
Thank you. Thank you for having us. I'm also delighted to share the work that we're doing on this platform and with your viewers.
Jump right to hearing about Alter and the work being done in the greater Boston area. I think it would be of interest for each of you to just very briefly share a little bit more about your background, professional interests, perhaps current positions. Fayron, would you please start?
Yeah, sure. And so, in addition to your introduction, I want to make sure that I stress that I'm a nurse, right? I've been a nurse for over 25 years, and I think that's very important and really speaks to how I approach the solutions and support families. I'm also a woman of faith. I think that's also important because that also shares the lens that I'm looking through when I am trying to serve our communities and families. Currently, in addition to being the founder of Alter, I serve as the Associate Dean of Nursing at Georgia State University. So I do have a lot on my plate, but at no matter where I am or what role I'm serving in, it's always about serving families.
Nice, nice, wonderful. Well, eager to hear much more about how you work with families shortly. Tia, welcome. Please share a little bit about your background.
Thank you, Jay. Honored to be here. In addition to what you already introduced, I am a psychiatric mental health nurse practitioner, and I am the float nurse manager for Good Shepherd Community Care.
Terrific, terrific. Well, also eager to hear about your involvement, especially with the Greater Boston community soon. Fayron, for viewers who may be learning about Alta for the first time, what inspired you to create the organization and what gap were you hoping to fill?
Yeah, I think I need to just back it up a little bit. It's before the organization, right? Because I don't have a personal story. Many people that are in this and in this movement, they have a personal story, a parent, a grandparent, or a sibling. And I didn't have such as when I get started. But what I did see during my postdoc years, I saw a drastic disparity. I've seen how dementia, like Alzheimer's disease, was disproportionately impacting African American communities and families. And I did not know this. As a nurse, having my PhD, I wasn't aware of this
Mm.
statistic. So really, my passion started then. My inquiry and my exploration started at that moment when I ran across the facts and figures that is produced by the Alzheimer's Association every spring. And I seen these numbers of twice more likely to have dementia compared to their white counterparts. And that's
Mhm.
when I really got on this mission to find families, to learn from them. And then when I moved to Atlanta, I still was looking for families, learning about the community. And several times it came up, you need to go back to the church. You need to educate our faith leaders. You need to start with the church. And my current pastor at that time, still my pastor, he said, start a ministry. And I was like, what ministry? And so when I told him what I did for work, he said, well, in my research, he said, that's your ministry. So Alter is truly a ministry. And I'm just so grateful that this ministry crosses over from my professional and personal life. But actually, that's when it started. And it started off just as education. And then I say about a year afterwards, we were educating the community in the Atlanta metro area, but we got so many questions about how to apply this education. And I just want to say, for those that are listening, especially professionals, education is great, but I don't think we should stop at education. And that's where Alta was really birthed because we decided not to stop at education and create a full-fledged program so we can truly equip our faith communities to respond to this crisis.
Terrific, terrific. What are some of the biggest misconceptions about Alzheimer's disease and dementia that you encounter in the communities you serve?
Yeah, I will say some and then I'll pass it to you, Tia, to see if you think. And I think one of the things when I started this, it was really it wasn't recognized as dementia, right? And so these signs and symptoms were maybe seen as just normal. This what happens when people age, right? Also, many
Mm,
times, many families may have seen this as that they were eventually just called this crazy, right? Our person is crazy. And then through my work, especially, I would say local, nationally, but also internationally, when we go over into Africa, Ghana, uh, we also get this as being a spiritual condition and misconception of this being the person who has signs and symptoms being maybe cursed or
mm.
being a witch or a wizard. And so those are some of the things that I've seen over my 10 years in this space. Tia, I would just,
Yes, Dr. Epps, I echo you. I went to a church yesterday, and so many people are still afraid to raise their hands or the stigma associated with dementia to say, like, my loved one has it. It's something that becomes, when they get the diagnosis, shameful, as if they're pushed to the side, forgotten about.
Mm, mm. Yeah, no, the work you do for information, as you said, Fayron, education's the first step, which you provide, and then take it to service and care that you can offer with resources after that. Building on that, Alta brings together faith leaders, healthcare professionals, researchers, and caregivers. Fayron, why is that multidisciplinary approach so important?
You're muted, Dr. Epps.
I was doing good up until now. But in response to why that multidisciplinary approach is so important, I think that's the only way we can really come up with a solution. We can't, healthcare professionals cannot do it all by themselves, researchers cannot either, and families cannot do it. And so we have the Alter Dementia Summit, and when we're working with churches, the whole goal is to bring everyone together so we can come up with a solution together. We can share, learn from each other, and I think that's very important.
Could you walk us through what happens when a church becomes an altar partner?
Yes. So first, I'll back it up. I'm gonna back it up again. We do not partner with every church. It is an application process. Because we're really looking at church readiness. I think we have to recognize every faith community may not be at a position to really put all the initiatives in place to really be recognized as a dementia-friendly congregation, dementia-friendly faith space. So, but once we go through the application process, they will be go through orientation and be onboarded. Our partnership is for 2 years. And over those 2 years, we are asking and partnering with our churches to implement initiatives under three pillars, which is support, education and awareness, and worship. And so they are selecting 2 to 3 initiatives. We have a menu of things that they can pick from, and they're selecting 2 to 3 initiatives under those buckets to implement. And the altar team is there to support them, connect them, not to do it, again, to equip them with the resources so they can put it in place. They can put the support group in place. They can do, and many churches are doing a food pantry, but not understanding how this food pantry can really impact those caregivers, those families facing dementia, because this is a lot of costs is associated with this disease. No matter what your background is, your class, everyone needs support and help. And so that's what we share with our churches. And for the worship piece, having our leaders understand about the length of service, having visual aids available, memory support staff, familiar hymns or songs, prayers. We explain all of that to them, and many of them may be doing some of this, but some may not. And then they would take that on, learn more about it, and start adapting their services, their environment. We also look at the physical environment as well, if it's not an online ministry, to see exactly what are those things that may need to be modified so it doesn't trigger any behaviors for that person living with dementia.
Very comprehensive approach. Tia, could you please begin by introducing us to Good Shepherd Community Care and describing its mission for viewers who may not be familiar with the organization?
Absolutely. Good Shepherd Community Care is more than just a hospice organization. So we have our PD-PAL program. We have our Parlin Residence House located in Wayland, Massachusetts. We have our multicultural program that we offer hospice care to Russian-speaking patients, Asian-speaking patients, and Latino-speaking patients. We also have our Heart Play and Camp Air in Boston, and that's a bereavement program to help teens and young adults navigate through grief and loss, regardless of where you're at. And we also have our palliative care program. And then that's just helping people at any stage in their serious illness diagnosis. But wherever branch you are connected with Good Shepherd, we're dedicated to delivering the highest quality of care, support, and education for those experiencing or anticipating serious illness or loss.
Mm,
That's our mission.
Thank you. What attracted Good Shepherd to partner with Dr. Epps and Alter?
So one of our nurses met Dr. Epps, and I was honored to go to the first Alter Dementia Summit in Atlanta. And it was a life-changing experience. It was amazing to see Dr. Epps bring community together for people from all different walks of life, so that we can educate, support, and understand what dementia really is about and the components of it. So throughout the summit, there's so much education. There's so much you can do. It's a great time. They're educating the youth. It's a really, really good time. You learn about people's story. You learn about how, I remember how someone was misdiagnosed. They had dementia and they were misdiagnosed for menopause. Like, you learn different things, and it's just an eye-opening experience, is how I can sum it up quickly.
How does this partnership fit with your organization's broader commitment to serving individuals and families living with serious illness and dementia?
So, Good Shepherds, we service a lot of people with Alzheimer's dementia. When you're on hospice, you have the prognosis of 6 months or less to live most of the time. Some people do graduate hospice,
Hmm.
but we do have a lot of clients that come on with the diagnosis of Alzheimer, dementia, congestive heart failure, cancer, COPD, different respiratory issues. But to say that whenever you're coming onto hospice, you're vulnerable. Um, and this vulnerability, we help you navigate through that because losing your independence is a very difficult thing. So we want to offer resources. And this is where Alter came in. I was talking to our medical director, and she was like, I am so glad we are partnering Alter because I have this family who's going through dementia and they're African American and they're having to rearrange the dosage of Seroquel to get them to church. And I'm like, yeah, no, we're finally having church dementia friendly spaces in the state of Massachusetts. We have three churches onboarding now: Faith Christian Church in Dorchester, Massachusetts, Bethel AME in Jamaica Plain, St. Paul AME in Cambridge, and we have Charles Street AME in Boston. So we want to get churches throughout the Boston area to help our families as well with Alzheimer's.
Could you share a little bit more what kinds of education programs or outreach activities you're coordinating in the Boston community?
So every year, Good Shepherd does our Good Institute dinner, but we also do fundraisers for the marathon. This year, we did a mix and mingle, just educating the people of what hospice is. So dementia has a stigma, so does hospice, especially within the African American community. People usually think when you're going on hospice, like they're going to drug you with medications until you die. But we want to take away that stigma, letting you know when you are on hospice, we want to provide support for you. You get the social work, you get the spiritual care, you can get musical therapy, pet therapy, and all of that. We provide all of that. It's not just, and you get a nurse to help you navigate through whatever stage of the illness you're at. And so it's not just, so a lot of people misconception of hospice is that you're going to be given morphine until you die. We're going to pump morphine into you until you die, which is a misconception, kind of like dementia with the church. A lot of people, like Dr. Epps mentioned earlier, thinks that you're cursed, you're crazy. That's why you have that disease. You're not praying enough. So really want to take away that stigma from and educate people on what dementia really is, what hospice is really about.
Through your association with Alter, what's been the response so far from churches, caregivers, and community members who have participated?
Dr. Epps, we love you. I went to a church yesterday to do a presentation of what Altar is all about. And I opened the segment. I was like, raise your hands if you're caring for someone living with dementia or know somebody. And the entire room, I promise you, the entire room, I didn't see a hand not raised. And it was a good 50, 60 people there because it was Bible vacation week. And they were so excited because they had never interacted with a program like that ever. There's a lady who came to me crying, saying that she went to the Alzheimer's Association for help and really didn't really get what she was looking for. So she's really excited that Alter is coming to their church, is coming to their platform, and their church is going to be a dementia friendly, safe space to worship, to educate, and even I'm so excited that we're even educating the next generation, which is very exciting.
Yes, and I would like to add, and thanks for sharing that, Tia. I think you really hit on with that particular attendee sharing with you that she went to the association and still just didn't get what she needed. I think one of the things we have to make sure why Alter a program like Alter is important because it's truly culturally responsive, right? And so there are amazing, great organizations and resources out there, but sometimes when you of a particular culture, race, and ethnicity,
Yeah.
it just makes a difference when you can get services from a trusted resource, but also services from a community that identifies with the same experiences that you may be going through. And so, Jay, as I'm in this space, so many people we know, and I want to acknowledge, we know dementia does not discriminate with age, race, and gender. It just doesn't discriminate at all, right? It impacts everyone. But there are unique experiences certain families, communities, races, and ethnicities go through. And I think we have to acknowledge that in order to be able to adapt our programs or create programs that are relatable and can speak to those unique experiences. And I think that's what Alter is. We're not creating an education program from ground zero, or we're not creating curriculum from ground zero. We are using existing things out there, but we're making it relatable. And that's what a lot of faith leaders they speak back to, and that's what they appreciate, that we are coming in and we're showing them how this we're showing examples and making sure that these families and churches can see themselves in this example and be able to take away from it and now have action.
Many dementia risk factors seem to be connected to chronic conditions such as diabetes, hypertension, heart disease. How important is it to view brain health as a part of overall health?
Very important.
Yeah, absolutely important. I'll let Dr. F speak on that, but before she speaks on that, I do also want to say bringing Alter to Boston has also awakened the churches firsthand to not forget the seniors, not forget that the family dynamics are not always mom and dad and child. There are some families that the grandchild is taking care of the grandparents. They were adopted. So Alter has really awakened a lot of the churches. And I'll give you a concrete example. I went to Faith Christian Church, which is an Alter partner. They're actually taking their elders on a retreat to Connecticut, a 1 day retreat called Sensational. And they're going to do some brain health activities and really educate on dementia and how you can be healthy, what you can eat to keep your brain healthy, to help you understand that disease progression. But go ahead, Dr. Epps. Sorry.
No, thank you for just sharing more about that. But
Yeah.
brain health is very, very important. So this is one of the things that we are really stressing. So it's not just the Alter program is not just addressing and supporting families affected by dementia. It's also reducing their risk. And by doing that, we are promoting brain health. We partner with several organizations to do like brain health in a box, brain health for faith leaders. Like we have a lot of initiatives because it is very, very important. And I don't think people understand what they do every day, how that impacts their brain health, what they put in their mouth that impacts your brain health, how active or inactive you are impacts your brain health, right? Staying up all night or getting some rest impacts your brain health. Being stressed or trying to meditate, all of that impacts your brain health. And these are things that have conversations and we see advertisements all over, but I don't think people are connecting the dots, how this truly impacts your brain health. And so when we are out there, we're educating on this and we're also encouraging our churches to promote brain health from the pulpit as well and change what they offer during a meeting they may do at church if it's around eating and doing exercising programs. And we've seen success because now they fully understand, they're starting to connect the dots and see how important this is. And you said a lot of chronic conditions, Jay. Um, Managing those chronic conditions is just as important as well, for brain health. And so, in communities of color, there is a higher prevalence of diabetes,
Mhm.
cardiovascular issues, strokes, chronic kidney disease, all of these things. And people are like, well, I didn't know if that had anything to do with your heart. A lot of the conditions, like I just said, diabetes, that impacts your vascular system. It can lead there. So I say everything is connected to the heart. Then everything is connected to the brain. And so we are making sure that our communities also really become familiar with the term know your numbers. right? And really monitoring your health status and seeing the doctor. We partner with the Alzheimer's Association with the U.S. Pointer Study. We've been working with them because not this summer, the summer before, they put out some significant results with this lifestyle intervention and how it can reduce cognitive decline. If you do it with a coach or if you don't do it with a coach, you we still seeing a reduction in cognitive decline in many communities. And so, again, it's so important that we promote brain health, but for us to understand what we've been doing every day impacts our brain health.
Well said, well said. Tia, if somebody watching today wants to become involved, whether as a volunteer, congregation member, healthcare professional, or caregiver, what opportunities are available through your initiatives in the Boston area?
Sure. They can always go to our website, goodshepherdcommunitycare.org. There is a link that links you also to the Alter website. And there's also a phone number that you can give us a call because at Good Shepherd, the number thing we say is we care. And that simply means integrity, dedication, compassion, stewardship, and respect define how we interact with our partners and how we interact with our patient and our community members. We are very grateful that we met Dr. Epps, and we were also at awe with her groundbreaking work, and we know we needed to make that partnership happen very fast. And we hope to keep that partnership for years to come.
Wonderful, wonderful. Uh, Fayron, in closing, looking ahead, say 5 to 10 years, what's your vision for Alter and how do you hope it can impact dementia care across the country?
Yeah, my vision for Alter is that we're in every city, every county, every state nationally, and then we're doing more internationally. My goal is for any family that really wants to connect with a faith community, that there will be one in their community that
Mm.
can be identified as being a dementia-friendly faith space. I like how you said a safe space, Tia. And so, that is the vision, and we're working toward that. We're in 27 states right now.
Wow.
And I believe our cities may be around 78 to 80 cities within those states. So you're saying wow, but we still got a lot of work to do. And and,
No.
and that is my vision. And for those that are tuning in, I'm asking, please share the word, spread it, let others know that this program exists. Have leaders reach out to us, reach out to Tia, so we can come in and bring more information and see if this is a good fit. Because at the end of the day, we are truly trying to serve our families, but also making sure that our communities are healthier.
Fantastic. Well, your vision and the work both you, Tia, and your colleagues are doing, so inspiring. Fayron, in closing, for viewers and others who want to find out more and keep in touch with Alter developments, what are some good ways to do that?
Yes, and so you can always come to our website, visit our website. It's alterdementia.com. And I want to make sure our listeners who are just listening, Alter is Alter. A lot of people think it's spelled like the altar at the church, but it's Alter, dementia.com. You can go to our website if you want to get in touch with us. On our website, there's a contact us page. But also for those that are on social media, we're on all platforms and you can see our updates there of events that we are doing. Also, how we highlight our church partners and the events that they have been doing. So please do visit, reach out to us. We are here to answer questions and connect and partner.
Terrific, terrific. Well, we'll be sure to list some of those resources in the closing credits. But unfortunately, we've come to the end of the program. I want to thank both of you so much for taking the time to be here. So informative, important work. And just want to end by wishing you continued success with future endeavors. Thank you very much.
Thank you,
Thank-
Jay, for having us.
Thanks.
Also want to thank those of you watching for tuning in and hope you'll be able to drop by next time.